My name is Mike Pishvaian. I'm a GI oncologist at Johns Hopkins University. For patients who are concerned about esophageal or gastric cancer, the question is, are there any risk factors that can lead to the development of these kinds of cancers? And I'll separate these risk factors into two subgroups. One are non-modifiable risk factors, and the other is modifiable risk factors. The non-modifiable risk factors include things like age, where patients who are older are at greater risk, gender, males are at greater risk than females, and certain ethnic groups. African Americans, Native Americans, Hispanic Americans are all at greater risk of developing these cancers. And there are certain parts of the world where these cancers are actually much more prevalent, including especially East Asia for gastric cancers. But in terms of the modifiable risk factors, the things that we can do to change our potential risk for developing these cancers, there are several there as well. First of all, obesity and certain dietary habits have been associated with an increased risk of esophageal or gastric cancer. And the dietary habits in particular are patients who eat a lot of processed foods or eat a lot of charcoal grilled or nitrate-containing foods. They're at greater risk for developing both of these cancers, while patients who eat a lot of fresh fruit have a lower risk of developing esophageal and gastric cancers. Smoking is one that is often discussed as well. And unfortunately, smoking is definitely associated with an increased risk for these types of cancers. And I would strongly advise quitting smoking for any patient. One of the questions that comes up from time to time is, does that include smoking marijuana? The honest truth is that we don't know. I do sometimes encourage my cancer patients to use marijuana for appetite stimulation and to suppress nausea. But I actually recommend that they use marijuana edibles if they can, and again, try and avoid smoking. And finally, alcohol use can definitely be associated with these cancers as well. We know from a cardiovascular point of view that drinking some alcohol actually can be of benefit. So when we're talking about the alcohol risk, it's really for patients who are drinking 3 drinks or more per day that are at increased risk of developing esophageal or gastric cancers. Specifically for esophageal cancer, there's also the risk for patients who have Barrett's esophagus, which is an endoscopic finding, a finding when the patient sees their gastroenterologist and has a procedure. That risk can be also linked to heartburn or gastroesophageal reflux disease, but I want to make it clear that not every patient with heartburn is going to have Barrett's esophagus, and not every patient with heartburn is going to have esophageal cancer. It's really just that heartburn should be a trigger, especially if it's new and you're 55 years old, should be a trigger to go and see a gastroenterologist and have an endoscopy. Finally, one question that I'll often get from my patients that I do want to address is that all of these modifiable risk factors that we're talking about are in the context of developing esophageal cancers or developing gastric cancers. Unfortunately, for patients who already have an esophageal or gastric cancer, there's no clear evidence that these things can help. There is evidence that decreasing smoking, increasing exercise can definitely improve tolerance to chemotherapy and perhaps even improve outcomes. But really, once the cancer is there, these other modifiable risk factors are not going to improve the treatment of the cancer.